right, so when looking at the heart, you want to make sure that you first be able to identify the superior vena cava and then the inferior vena cava, because they're going to show you what side is the right side. And so if we open that first chamber, this is going to be your right atrium, which again is connected to superior vena cava and the inferior vena cava. This is a site, a dumping site for deoxygenated blood, or blood that's already used up its oxygen. So from here, we're going to go through our first valve, which is going to be our tricuspid valve. The function of all valves is to regulate backflow. It prevents things from, once it's gone in there, it doesn't come back out. And that's going to be our tricuspid valve. If we look at our next chamber, this is going to be our right ventricle, which has our tricuspid valve, named after the three flaps that it has. And then you can see very closely that it has these little tiny little cords here. Those are called tendinous cords in Latin, or cordae tendinea. And so they're going to be attached to papillary muscles. And when this contracts, they regulate whether this stays open or closed. And so with that, once blood is here, its overall objective is to go to the lungs. So it makes sense that we're going to go through a little door or a little gateway called the pulmonary semilunar valve, which regulates things from flowing back into the ventricle. Once it goes through that valve, we enter our pulmonary trunk, and it's called a trunk because it's going to start branching much like a tree. And so then we have our pulmonary branches, but these are actually called pulmonary arteries. Always remember that arteries lead blood away from the heart and veins bring it back to the heart. So then you can see that blood is going to flow to this side. It's going to go to the left lung, and then on this side it's going to go through, and you can kind of see eventually that it comes out from the other side to go to the other lung, the right side. And then so it's going to go full circle, right? It's going to go in the lungs, and it's going to get reoxygenated, and it's got to come back. Now the story of the right side ends, and now the left side begins. And so you can see here, blood is going to return through the pulmonary veins, and it's all, even though this is on this side, it actually goes all the way to the left side. So the overall goal of the pulmonary veins is to bring oxygenated blood back to the left atria, because that's the dumping site for oxygenated blood from the lungs. We're then going to go through our bicuspid valve, which is also going to have cordae tendinea and also have papillary muscles in this ventricle. This is going to be our left ventricle. And now, when we think about this next objective now, is that if you look very underneath it, there's a second valve, number 45 right there. And that's going to be your aortic semilunar valve. And this does not lead back into this left atria. It leads to the aorta. You just can't see it because it's so intertwined. Like, all these things are so intertwined. But otherwise, it goes through that aortic semilunar valve. And then now blood will be able to go and be able to provide blood to the rest of the body through this aorta. And that's the way to learn the structures, using the pathway of blood. And now there's some other structures that are important. We have, for example, this very centerpiece here, this deep muscle here that separates both ventricles. That's going to be the interventricular septum. And in any space, like the space that's pretty much this wall and this wall, but separating the atria, is called interatrial septum. And you'll also see this tiny little ligament here. This is called your ligamentum arteriosum. And now, what other structures are we missing? Oh yeah, right. Now, when you examine the heart on this, like a superficial view, this top portion above my hand is the line part that I'm making here is the base. This is the base of the heart, where all the vessels are. Apex is this football end here, the football-looking shape of it. These are auricles. I'm not quite sure these are even on your list. I don't remember. They are not, but these are little ear flaps here on top of the atria, auricle. And when you look at the next terms that matter are coronary vessels. When you think about blood now, we talked about that the aorta now has oxygenated blood. It came from the left ventricle, that came from the lungs. And so sometimes, or not most sometimes, but your heart itself needs blood. This is muscle that needs oxygen too. It doesn't get it from the inside, it gets it from these little blood vessels leaving the aorta. So if we go to the right side, you'll notice that here we have number 31 here. This is going to be your right atria, because this blood vessel goes and feeds blood to the right side. Now, If we go to the other side, this is going to be the left coronary artery because it's going to the left side. That's it. And then you don't actually have to know the names of the rest of these arteries, the ones in red, but you have to imagine to yourself, or because you do have to know great cardiac vein, which is this blue one. Now, when blood leaves the aorta, it's oxygenated, it's going to provide oxygen to all this tissue. But then it's used the oxygen now, and that blood cell has to make its way back into the lungs. So the only pathway you have to know for our exam is that this artery will deliver it here, and then the great cardiac vein will bring it back, and then it'll eventually find its way into the next structure that matters for you, and that's going to be the coronary sinus. The coronary sinus does the same thing that the inferior vena cava and the superior vena cava do, that they bring deoxygenated blood into the right chamber. I can always remember that this is the coronary sinus because it is on the right side, but not under the inferior vena cava, just that little segment here. And a coronary implies everything that's around the heart that wraps around underneath the vessels, in case you were wondering that. But all of this is coronary. And I think that is everything. Nice, yeah.